Chanel made a special trip to LA all the way from Alaska to meet podiatrist Dr. Ali Sadre.
Chanel has a very common situation in patients that have a longer toe, which gets pushed back and becomes a hammer toe. We're going to straighten and shorten the second toe by doing a fusion. So you put the incision directly in the middle. We're going to dislocate the toe, and there it is. You can see the joint. So what we're going to do is we're going to remove the head of the joint. There it is. Now let's get ready for placing this implant. We're going to drill a small hole. This sits inside of her toe, holding those two bones together. And we just carefully and precisely thread it in. And then what we do is we place the little cut that we did over the blades, and we slowly push it on. So what you see here is perfect juxtaposition of the two bones, which is basically a perfect fusion. Look at how perfect the length of that toe is. All right, so now we're going to do a tailor's bunion. We cut the bone, we shift it over so the angle is corrected, and then we reattach it with a screw. All right, so we're going to start on the second foot. Case went great, nice and smooth. She did very well. The toe is perfectly positioned and aligned, and she's going to be very happy.
Well, we're here with podiatrist Dr. Ali Sadre and his patient Chanel. And obviously this isn't the ultimate look we're going for, so we're going to display those toes in just a minute. But this is a new way of doing this,
This
Dr.
is.
Sadre?
It's an improved way over the traditional techniques. If we take a look at her dressings, what you can see is that the procedure doesn't involve anything protruding from her foot. The traditional way of doing these things, we use something called a K-wire. And a K-wire is a device that holds the bones together while they heal. The difficulty with this is the patient has a 6 to 8 week recovery before this thing heals, and this thing is sticking out of her toe and has to come out. So it's kind of unsightly, it's difficult because it can bend, it can break, it causes infection. So this K-wire process has been eliminated with this new technique. If you'd like to see an animation, you'll see that the procedure basically is shown. Okay. You can see that the procedure shows what we do is first remove the bone. Once we remove that knuckle, we actually drill a hole inside the bones to place this new internal implant. Now this implant sits inside the bones, connecting the two toes together. And we drill it carefully. You see the prongs basically hold the toe straight so it doesn't dislocate. Now this is key because a traditional K-wire technique is loose. It's just a metal wire. It can actually dislocate. On her toe, this is internal and stays inside indefinitely. So if she has a different healing process and let's say a different patient, she can actually have continued internal fixation, which gives her a reliable result. You ready to see your feet?
Yes.
And the great thing here, you're doing more than one thing at one time, right?
Yes, sir.
Getting it all done for her in one sitting, and in this case, both feet.
Yeah.
Absolutely. In this particular procedure, what we could do is actually remove not only her tailor's bunion, which gives her calluses on the side and difficulty wearing shoes, but also shorten and straighten that toe. Now remember, this is a fusion procedure that gives her a reliable long-term result. And the beauty of this technique is that within a 2-week period of time, once the skin is healed, Chanel can start wearing normal shoes, and within 4 weeks, once the bone is fused, she's back into all her normal shoes. You can see that this is, when do we do this? Wednesdays? This is a 2-day post-op, and you can see how clean everything is. Her little silver dressings.
And look at that length. Isn't
And
that
the
nice?
toes still have the
Now,
polish on. That's impressive. You went into surgery with some cute toes.
so, thank you.
And these x-rays will show actually what's happening with the bones of your foot. We have a before and after x-ray here. Talk to us about what we're seeing.
So if you take a look at this pre-op x-ray, what you can see is she has a tailor's bunion on the outside. Those bones flare out on the outside, causing that bump, which she's young right now, but those can become significant as she ages and cause a callus, which is
So the bunions
irreparable.
we're talking about over in this area
On the
both
outside,
sides.
exactly.
Yes.
So that narrows the foot and gives her some relief from wearing shoes. But then more importantly, the second toe, because it was longer, was kinking up, pushing back. So what we're compelled to do is straighten it out, but also shorten it. That's what this device helps us do. And you see on the post-op x-ray that those screws are actually holding the toe indefinitely until it fuses.
And so she'll be back on her feet very shortly.
She
then.
will. She can walk normally. I have patients be careful with these because we want to make sure that things go well for the first 2 weeks. So especially when there's 2 feet at a time, we want to make sure that they walk carefully, so we give them crutches. But the point is that in 2 weeks, she's going to be in tennis shoes, and in 4 weeks, she's going to be in her normal shoes. Now, everybody asks, can I do anything other than surgery? And they can. The thing is that these things aren't definitive results, but they can postpone the surgical experience. Things like toe splints that people buy that they put in between the toes and separate the toes. There are also little splints that your local podiatrist can provide you.
Surgery is obviously the end point, so if you can use conservative measures, go for those. Dr. Sadre, great work as always. We appreciate
Thank you so much.
it. Now,
Good to see you
best of
again.
luck to you.